Okay, so this is our teaching project for pediatrics. So we're gonna knock on the door. Hey there, Sabina. I'm Zach. I'm gonna be your nurse.
I'm Megan. I'm also going to be your nurse today. How are you feeling?
So we just have some discharge education to go over with you since you're gonna be going home today, okay? And her and her mom say okay. And I'm not really on the camera, but we'll roll with it. So you came in today with dehydration. So we're gonna teach you and your mother about signs and symptoms of dehydration, kind of what to expect, how to prevent it, what can cause it, and then if they need to come back into the hospital, when should they come back into the hospital?
And is now an okay time to do this? Do you need to make any phone calls or anything? No? Okay, that's great.
Yeah, we'll do that. All right, so she gets comfortable, and now so we'll talk about our signs and symptoms. So signs and symptoms of dehydration in children, we typically can see few or no tears if they begin to start crying. Their eyes may look sunken. In a baby, the top of their head can also be sunken in. They could go ahead.
They may just be more irritable, not peeing as much, or you may not notice wet diapers in baby. Dry mouth might be drowsy, dizzy, nauseous, vomiting.
Dry mouth, and with their peeing, it may look a little bit more darker, more amber, and it could have a odor to it as well. So with children, dehydration is a little bit more or children are more vulnerable to dehydration because they have a higher surface area and more volume area. So what that basically means is that compared to adults, they typically tend to lose fluids a lot faster than someone like an adult if they have a fever or are vomiting or have diarrhea. So, and it also can be a little bit more difficult for a child to express their needs to need to drink, or if they are dehydrated, to try and rehydrate themselves a little bit more. So, common causes, kind of like I said earlier, are going to be, vomiting, diarrhea, if they have a high fever, which then can also lead to excessive sweating. So, excessive sweating obviously can include your fever, or maybe it's hot outside and they're working out a lot, or exercising, I should really say. Or if they're kind of the opposite, if they're peeing a lot, so then they're also losing a lot of that fluids that they currently have inside their body.
So, the main goal, if your child is sick, is to prevent dehydration, and sometimes that can be difficult, especially with a stomach bug, with the already nauseated and vomiting and diarrhea going on. But you'll want to avoid juices, water, things that aren't really going to replace their electrolyte levels, and instead use something such as OTR or Pedialyte, so that can help to replace that and prevent more complications and more nausea, vomiting. And it's important just to give a little bit at a time. Don't have them, drink a whole bottle of it, because they're probably just going to throw it back up again.
Yeah, and kind of like with the causes, trying to stay hydrated before and after exercising. If it's hot out and they're sweating, drink more water before, so they don't lose all that water through sweating. If it's cold outside, there's a lot of dry air, so they could drink some more water before then, just to kind of help prevent dehydration. Uh, so yeah, kind of like what Megan was saying. So we're gonna give them fluids, so like oral rehydration. Pedialyte's a good, uh, not nutrient fluid, because it has a lot of the electrolytes that we lose when we like sweat or vomit or have diarrhea. So it's a good drink that contains everything that we could need. Obviously, clear liquids. If they aren't tolerating fluids, we can have them suck on ice chips. That sometimes can help alleviate it, or other frozen liquids like popsicles, ice cream. You can also use like broth or saltines, kind of to help. Not it's not so much acidic with vomiting, and then promoting adequate rest and sleep along with the hydration can also help, especially if they have like a stomach bug. So
So there's some different medications you can use. There's Dramatine to help with, the nauseous feelings. Pepto Bismol for nausea and vomiting. Tums Tylenol if there's a fever, but it's important to make sure that you're following the dosing guidelines based on your child's weight and that you're only giving the amount that can be given within a 24-hour period.
So then, after we educated both Sabina and her mother, they teach back to us, what we all taught them about dehydration, how to prevent it, the cause, um, signs and symptoms, potential medications that they can take over the counter, and then her and her mother state once again what types of fluids and diet are acceptable, signs and symptoms, and when to need to return to the clinic. So that would be like continued vomiting, diarrhea, or other signs and symptoms, or like no urine output in 6 hours, or other common signs and symptoms of dehydration. Um, and then like as tolerated, pushing or advancing their diet so they can tolerate more food and fluids to prevent that dehydration.
So we taught Sabine and her mother with oral instruction, and we can go ahead and give them a handout too. But of course, if there were any barriers, such as language or like anything else, we can go ahead and change that to fit the patient and the situation.